The following segment is sponsored by the Prince George's County Health Department. In this series, we reintroduce you to Ending the Epidemic, a plan for America, which involves Prince George's County Health Department's efforts to cancel HIV. Recently, Ellen chatted with Division Director Diane Young about the stigma surrounding the disease.
Diane, I love getting to talk to you again about the Cancel HIV efforts, especially what we started to talk about last time was that stigma that people have around HIV. Are you still seeing that?
We are. I did mention stigma the last time. There's a cyclical relationship between stigma and HIV. People who experience stigma also get discriminated against and are marginalized and are made more vulnerable to HIV. And those that are living with HIV are more vulnerable to experiencing stigma and discrimination.
Do you see an impact in Prince George's County when it comes to that stigma and maybe the rate of being able to help people with HIV?
We really do, Ellen. It has a negative impact because stigma and discrimination manifests itself in many ways. It's a human rights violation. You see it in healthcare settings. It keeps people from accessing healthcare, and they're often not getting the quality of care that they need because they don't speak up. They're often also shunned by their community. Stigma also impacts those who have traditionally been marginalized by race and are perceived as displaying unacceptable behavior, like men that have sex with other men. That's a stigma within our own community, and we need to do something about that. It stops people from getting health care as well as housing and all the other support services that wrap around it.
I feel like you mentioned many of the reasons why that stigma is there. Is there maybe like a root cause behind HIV stigma?
Yeah, Ellen, we've been seeing this for a number of years. There's a fear around HIV, regardless of the information that's out there, much like what you see today around COVID-19. Many of the thoughts and ideas about HIV comes from the images of the 80s and the early 90s.
Right.
And when people were very afraid, and the lack of information and awareness combined with outdated beliefs creates additional stigma, which is why we want to focus on eliminating that.
That's absolutely where my mind goes, right, to the 80s and the 90s, but we've come so far since then. It's decades later. So what are we doing to address that stigma?
We have to talk openly about it, keeping in mind that our words matter. When we're talking about HIV, certain words and languages have a negative impact and meaning for the community. So we have to keep those things in mind. We want to do our part by being intentional in our words and intentional in our thoughts when we're talking about HIV.
Absolutely. And then that will lead to the cure, right? Or to getting more people in and getting help.
That's right.
Diane, thank you so much for joining us again today.
Thank you.
We can all help end HIV stigma through our words and actions in our everyday lives. Lead others with supportive behaviors and not judgment. And for more information, just type #CancelHIVPGC in your search bar on your phone or desktop, and you will see plenty of information.